America's true heroes, the servicemen and women who fought to defend our freedoms, are dying at the rate of hundreds per day. When doctors have done all they can for these patients, they sometimes end up in the professional care of a hospice facility. Now, one local hospice is making a special effort to recognize those who served and sacrificed. Joining us now is Lori Showalter. She is the volunteer coordinator for Augusta Health Hospice, which is located on the Augusta Health campus in Fishersville. And Lori, tell us about the Hospice Veterans Program.
Okay. We all know that hospice professionals across America focus on providing comfort and support to patients in their home. So the Veterans Campaign is part of National Hospice and Palliative Care Organization, collaborating with the VA to provide a little more care not more care, but specific care to the veterans. 1 out of every 4 people dying in America are veterans. And they have unique needs at the end of life, sometimes from traumatic war experiences or physical injuries, psychosocial issues. And part of this campaign is to provide veteran-to-veteran contact through volunteers, to have a veteran volunteer who may understand and know a little bit more, help that person unload a little bit, things that have been buried deep inside for years. Also, the vast majority of these veterans don't realize the benefits that are available to them through the VA, even the hospice Medicare benefits. So having these veterans on board just helps kind of with that collaboration of care to provide a little extra love and support to these folks that served our country.
So we combine volunteer veterans to help with this program and be the conduit or the contact a lot of times for these veterans.
That's right.
Okay.
And they tend to open up, more with somebody who's been there, experienced that. And we have one veteran in our care, a volunteer that retired from the Army after 21 years of service. He was a first lieutenant, and last year alone, he visited over 100 patients within our hospice. We have, on average, 10 to 15 veterans at a time in our care. And he takes these medallions out, branch specific, whether they're Army, Navy, Air Force, Marine, Coast Guard, and he salutes these patients and honors them and thanks them for the service that they gave to our country, whether it was 6 months or a career. And he also takes out these veteran-specific lap quilts, and these are made by volunteers, and the Shenandoah Valley Quilters Guild makes these for us on a regular basis, and they're all Americana fabric. And it's just a little token of our appreciation to them at the end of their journey, just to say, you gave all for us. Thanks for what you did. Let's honor you in this small way.
Now, is this Hospice Veterans Program a part of all hospices?
That's a great question, and we would like it to be, but you have to opt into that. It's a national campaign, as I said, through NHPCO, and every hospice has the opportunity to become part of that through their website.
Okay. Now, tell us about the hospice criteria for being accepted into hospice.
To be accepted into hospice, you have to have a life-limiting illness, normally with a prognosis of 6 months or less if the disease runs its normal course. All curative treatment has to stop, and of course the physician has to agree to hospice care. And normally a caregiver is in place. We do have some patients that live alone. But the main thing is that curative treatment has stopped, everything becomes palliative at that point, and our focus is comfort care and keeping the patient comfortable where they want to be.
And it can be in their own home, it can be at a hospice, at the hospice at Augusta Health. So
nursing home.
Different ways to go. And are there age limitations for hospice?
There are not. Not all hospices serve the pediatric population. We happen to be one that does, so we do not have age limitations within our hospice. We serve pediatrics all the way through. I think our oldest patient was 105.
All right, very good. Well, I want to thank Lori Showalter, the volunteer coordinator with Augusta Health Hospice, for joining us.
Thank you.